Hi, my name's Abigail Moore, and I'm the CEO here for the San Antonio Council on Alcohol and Drug Awareness. Our communities were really impacted by COVID, and the ARPA funds were able to be used by these communities to bring healing and recovery and also to help communities thrive. We are known as one of the states that has a lower rate of insurance, providing insurance to its residents, and so the impact of COVID rippled in a huge way in our communities. And so we definitely saw it here in Bexar County and the surrounding counties, and a lot of that impact was people were very sick, lives were lost, a lot of depression, anxiety, loss of employment, the impact on families, children's school, and their ability to do well in school and to connect with their friends. Of course, there were the students that didn't get to graduate and cross the stage. So much impact that COVID had on our community, and it continues to ripple on several years later. The state of Texas received funding, federal funding, ARPA funding, which is the American Rescue Plan Act funding. And this funding came to our state, and our state decided to join and partner with community coalitions. And since we've had partnerships with our residents and people in our community for over 20 years through our coalition work, we were able to receive this money. And because relationships already existed, communities trusted us, we were able to visit with them, meet with them, and they were able to share with us and identify what are the things that are really impacting us. So whether they didn't have parks, enough lighting, some schools didn't have quiet wellness rooms, places where kids or teachers can go and reflect and calm down and maybe just rest from a very difficult day. So many different opportunities were shared to us by our partners, a need. And the funding from ARPA, we were able to take those funds and give them right back to the community and be able to serve them where the need was there the most. Because we really listened to our community and the community had the feedback on what their needs were, we were able to put projects exactly for what that community needed. For example, we did community gardens, wellness rooms for teachers, just so many other projects. And the whole purpose and idea was mental wellness, stress relief, people being able to engage and reconnect with each other and recover and heal from the impact of COVID. After listening to our community and also identifying that some of the challenges were being able to deal with trauma, being able to deal with stigma and the reduction of stigma, we were able to bring videos and movies and films to the community to really highlight the importance and normalizing, being able to ask for help, being able to identify, hey, I'm really struggling with my mental wellness right now, and there are agencies that can help. So being able to connect to community partners that could help them with those things. ARPA funds also allowed us the opportunity to provide extensive training to our community, training on how to have a plan and how to help your community with suicide prevention. So we were able to bring dollars to these communities and provide the training that they needed so they felt comfortable being able to provide suicide prevention to youth and their community. So we were able to identify best practices and provide training. And we used the training, counseling on access to lethal means for the community, able to equip them to be able to have a plan and how do we remove dangerous weapons from our community and make it safer so those means that people might do self-harm with are away from people. And so people have tools and they're able to access those resources. And those trainings are vital to be able to provide a strong community, especially with the impact of the ripple effect of COVID. We just want to thank all our community partners, the state of Texas, and the ARPA funds that came nationally, that we were all able to work together and bring these projects to our community and create wellness opportunities, safety opportunities, and just be able to thrive as a community. I encourage you to reach out to these partners and connect, learn a little bit more about the projects. Also, reach out to our agency, the San Antonio Council on Alcohol and Drug Awareness, and get involved.